Prostate: functions, role in men's health, and the reproductive system. The prostate gland is a vital part of the male reproductive system. It is a small gland, about the size of a walnut, located just below the bladder and surrounding the urethra, the tube through which urine exits the body. Despite its small size, the prostate performs several critically important functions that affect a man's health, reproductive ability, and overall quality of life. The role of the prostate in the male body. The primary function of the prostate is to produce and store prostatic fluid, which makes up a significant portion of semen. This fluid plays a crucial role in reproduction, as it nourishes the sperm and provides protection and transportation. Sperm leave the testicles and travel through the reproductive ducts, mixing with fluids from the prostate and seminal vesicles. This combination forms semen, which is capable of surviving the acidic environment of the female reproductive system and reaching the egg. However, the prostate's role goes beyond fluid production. It also helps regulate urination. Due to its location around the urethra, the prostate helps control the flow of urine and prevents involuntary leakage. Thus, prostate health is vital not only for reproductive function, but also for the proper functioning of the urinary system. The prostate in sexual pleasure. The prostate plays a key role in achieving sexual pleasure. During sexual arousal, the muscles of the prostate contract, aiding in the release of semen during orgasm. These contractions are part of the complex mechanisms that make orgasm possible. Without the involvement of the prostate, this process would not occur. Regular sexual activity helps keep the prostate active, which supports its health. However, both excessive and insufficient activity can affect how the gland functions. The impact of daily masturbation on the prostate. Masturbation is a normal and common practice among men of all ages. It has a direct impact on the prostate because it is related to the frequency of semen production and release. Let's explore what changes occur in the prostate with daily masturbation and how it may affect its health. Increased activity and its effects. Daily ejaculation stimulates the prostate to continually produce seminal fluid. On the one hand, this helps maintain the gland's activity and prevents fluid buildup, reducing the risk of inflammation or infection. On the other hand, if the gland doesn't get enough time to recover, it may temporarily enlarge. Excessive prostate activity can sometimes lead to benign prostatic hyperplasia, BPH, a condition in which the gland increases in size, potentially compressing the urethra. Symptoms may include difficulty urinating, a sensation of incomplete bladder emptying, and pelvic discomfort. While these symptoms rarely appear in young men, it's important to monitor changes to prevent complications. Hormonal changes. Masturbation affects hormone levels that regulate prostate function. The key hormones involved are testosterone and its derivative, dihydrotestosterone, DHT. Testosterone stimulates the growth and function of the prostate, while DHT helps maintain its structure. Frequent sexual activity may temporarily increase these hormone levels, which can influence the size and sensitivity of the gland. Some studies suggest that frequent masturbation may alter the composition of seminal fluid. For example, DHT levels can affect its viscosity, potentially influencing fertility. However, these changes are usually reversible and not harmful when sexual activity is kept within reasonable limits. Benefits of regular ejaculation. Despite potential risks, Regular masturbation offers several health benefits for the prostate. Here are the main advantages. Prevention of prostatitis. Prostatitis is inflammation of the prostate, which can cause severe pain, difficulty urinating, and general discomfort. Regular ejaculation helps prevent fluid stagnation in the prostate, reducing the risk of inflammation. Routine clearance of the gland also lowers the chances of bacterial infection. Lower risk of prostate cancer. Some studies suggest that frequent ejaculation reduces the risk of prostate cancer. Regular emptying of the gland may help eliminate potentially harmful substances that could contribute to cancer cell development. For example, men who ejaculated 21 or more times per month were found to have a lower risk of prostate cancer compared to those who did so less frequently. Maintaining overall prostate health. Regular activity improves blood circulation in the prostate and prevents the formation of calcifications, solid deposits that can cause pain and inflammation. A healthy prostate also supports the overall urinary system, reducing the risk of infections. Potential issues with excessive activity. As with any aspect of life, balance is key. Excessive masturbation can lead to certain side effects, particularly if it becomes an uncontrollable habit. Prostate fatigue. Constant overuse of the prostate may lead to fatigue. Symptoms can include reduced semen volume, less intense orgasms, and pelvic discomfort. In such cases, reducing the frequency of sexual activity is recommended to allow the gland to recover. Irritation and inflammation. Intense masturbation may cause microtrauma to tissues and the prostate itself, increasing the risk of inflammation. Men may experience a feeling of heaviness or dull pain in the lower abdomen, an indicator that medical attention may be needed. Benign prostatic hyperplasia, BPH. Although daily masturbation alone does not cause BPH, it may aggravate existing symptoms if the gland is already enlarged. This condition is more common in older men, making it important to monitor prostate health from an early age. Maintaining prostate health. To minimize risks and maximize the benefits of sexual activity, consider the following guidelines. Balanced diet. Nutrition plays a vital role in prostate health. Consume foods rich in zinc, vitamin D, and omega-3 fatty acids. These nutrients help reduce inflammation and support glandular function. Physical activity. Regular exercise, especially aerobic workouts, improves blood flow and reduces the risk of prostate problems. Avoid harmful habits. Limit excessive alcohol and tobacco use, as both contribute to chronic inflammation. Routine checkups. See a healthcare provider regularly for preventive exams, particularly if you have a family history of prostate conditions. Conclusion. The prostate is a small yet critically important organ in the male reproductive system. Its health depends on multiple factors, including sexual activity, diet, physical fitness, and lifestyle. Daily masturbation can be a part of a healthy routine, but it's essential to maintain balance and pay attention to your body's signals. Regular ejaculation helps prevent fluid buildup, reduces inflammation risks, and may even protect against prostate cancer. However, excessive activity can cause fatigue or irritation of the gland, which requires attention and possible lifestyle adjustments. Listen to your body, lead a healthy lifestyle, and don't hesitate to consult a doctor at the first signs of discomfort. Your health is your top priority,